Subscribe for daily quizzes and let me know how many you got correct today. Here's some rare diseases trivia. Which autoimmune disease leads to muscle weakness? A. Celiac disease, or B. Sjogren's syndrome, or C. Myasthenia gravis, or D. Lupus? The correct answer is C. Myasthenia gravis. Which blood disorder prevents clotting? A. Hemophilia A, or B. Thalassemia, or C. Anemia, or D. Sickle cell? The correct answer is A. Hemophilia A. What genetic syndrome leads to developmental delay? A. Down syndrome, or B. Angelman syndrome, or C. Turner syndrome, or D. Marfan syndrome? The correct answer is B. Angelman syndrome. Which rare disease is caused by a defect in the enzyme? A. Fabry disease, or B. Usher disease, or C. Pompe disease, or D. Tay-Sachs disease? The correct answer is B. Usher disease. Which condition causes dysfunction in blood clotting? A. Von Willebrand disease, or B. Deep vein thrombosis, or C. Sickle cell anemia, or D. Hemophilia A? The correct answer is A. Von Willebrand disease. What genetic disorder is characterized by skin blisters? A. Lupus, or B. Epidermolysis bullosa, or C. Psoriasis, or D. Eczema? The correct answer is B. Epidermolysis bullosa. What genetic condition affects iron metabolism? A. Down syndrome, or B. Cystic fibrosis, or C. Hemochromatosis, or D. Sickle cell anemia? The correct answer is C. Hemochromatosis. Which neurological disorder affects motor skills? A. Spinal muscular atrophy, or B. Parkinson's disease, or C. Cerebral palsy, or D. Multiple sclerosis? The correct answer is A. Spinal muscular atrophy. What disease leads to reduced blood supply? A. Ischemic heart disease, or B. Diabetes, or C. Heartburn, or D. Asthma? The correct answer is A. Ischemic heart disease. Which autoimmune condition affects the skin and joints? A. Hashimoto's disease, or B. Psoriasis, or C. Rheumatoid arthritis, or D. Systemic lupus erythematosus? The correct answer is D. Systemic lupus erythematosus. Which rare genetic disorder involves craniofacial abnormalities? A. Apert syndrome, or B. Cystic fibrosis, or C. Turner syndrome, or D. Marfan syndrome? The correct answer is A. Apert syndrome. Which rare condition causes misfolded proteins? A. Cystic fibrosis, Huntington's disease, or C. Multiple sclerosis, or D. Amyloidosis? The correct answer is D. Amyloidosis. What disease originates from a missing enzyme? A. Type 2 diabetes, or B. Phenylketonuria, or C. Hypertension, or D. Cystic fibrosis? The correct answer is B. Phenylketonuria. Which genetic disorder is characterized by high cholesterol? A. Familial hypercholesterolemia, or B. Turner syndrome, or C. Cystic fibrosis, or D. Down syndrome? The correct answer is A. Familial hypercholesterolemia. What rare disease affects the peripheral nervous system? A. Guillain-Barré syndrome, or B. Multiple sclerosis, or C. Amyotrophic lateral sclerosis, or D. Charcot-Marie-Tooth disease? The correct answer is D. Charcot-Marie-Tooth disease. What rare genetic syndrome affects bones and joints? A. Langerhans cell histiocytosis, or B. Osteogenesis imperfecta, or C. Ehlers-Danlos, or D. Marfan syndrome? The correct answer is A. Langerhans cell histiocytosis. Which condition causes non-cancerous tumors in organs? A. Multiple sclerosis, or B. Celiac disease, or C. Neurofibromatosis type 1, or D. Fibromyalgia. The correct answer is C. Neurofibromatosis type 1. What condition involves inflammation of the aorta? A. Hypertension, or B. Takayasu arteritis, or C. Aortic dissection, or D. Raynaud's disease. The correct answer is B. Takayasu arteritis. What syndrome leads to vision loss and deafness? A. Retinitis pigmentosa, or B. Turner syndrome, or C. Usher syndrome, or D. Down syndrome. The correct answer is C. Usher syndrome. Which rare metabolic disorder affects fat breakdown? A. Galactosemia, or B. Maple syrup urine, or C. Carnitine deficiency, or D. Glycogen storage disease. The correct answer is C. Carnitine deficiency. What genetic disorder affects melanin production? A. Cystic fibrosis, or B. Sickle cell, or C. Albinism, or D. Down syndrome. The correct answer is C. Albinism. What condition is characterized by multiple cysts? A. Ovarian cysts, or B. Cystic fibrosis, or C. Liver cirrhosis, or D. Polycystic kidney disease. The correct answer is D. Polycystic kidney disease. What syndrome is characterized by learning disabilities? A. Down syndrome, or B. Turner syndrome, or C. Williams syndrome, or D. Asperger syndrome. The correct answer is C. Williams syndrome. What genetic disorder involves progressive muscle weakness? A. Duchenne muscular dystrophy, or B. Cystic fibrosis, or C. Amyotrophic lateral sclerosis, or D. Facioscapulohumeral muscular dystrophy. The correct answer is D. Facioscapulohumeral muscular dystrophy. Which condition results from a deficiency in vitamin B1? A. Beriberi, or B. Scurvy, or C. Rickets, or pellagra. The correct answer is A. Beriberi. What rare genetic disorder is linked to a sulfur metabolism issue? Albinism, or B. Cystic fibrosis, or C. Homocystinuria, or D. Phenylketonuria. The correct answer is C. Homocystinuria. What rare genetic disorder causes hemolytic anemia? A. Hemophilia A, or B. Thalassemia minor, or C. Sickle cell disease, or D. Pyruvate kinase deficiency. The correct answer is D. Pyruvate kinase deficiency. What disorder is known for incomplete closure of the spine? A. Klippel-Feil syndrome, or B. Turner syndrome, or C. Spina bifida, or D. Polydactyly. The correct answer is C. Spina bifida. What syndrome involves developmental delays in autism? A. Tourette syndrome, or B. Down syndrome, or C. Fragile X syndrome, or D. Rett syndrome. The correct answer is D. Rett syndrome. Which genetic disorder leads to progressive retinal degeneration? A. Macular degeneration, or B. Retinitis pigmentosa, or C. Color blindness, or D. Hemophilia. The correct answer is B. Retinitis pigmentosa. What rare disease involves recurrent lung infections? A. Bronchiectasis, or B. Pulmonary embolism, or C. Asthma attack, or D. Cystic fibrosis. The correct answer is A. Bronchiectasis. What condition is characterized by hypervalinemia? A. Maple syrup urine disease, or B. Homocystinuria, or C. Phenylketonuria, or D. Alkaptonuria. The correct answer is A. Maple syrup urine disease. What metabolic disorder causes a deficiency in GALK1? A. Lactose intolerance, or B. Diabetes mellitus, or C. Galactosemia, or D. Glycogen storage disease. The correct answer is C. Galactosemia. What condition causes abnormalities in skin pigmentation? A. Vitiligo, or B. albinism, or C. nevus of oat psoriasis. The correct answer is C. nevus of Ota. Which syndrome is characterized by seizures and skin abnormalities? A. Down syndrome, or B. Tuberous sclerosis complex, or C. Epileptic encephalopathy, or D. Marfan syndrome. The correct answer is B. Tuberous sclerosis complex. What rare disease involves abnormal bone growth? A. Fibrodysplasia ossificans progressiva, or B. Osteogenesis imperfecta, or C. Paget's disease, or D. Cleft palate. The correct answer is A. Fibrodysplasia ossificans progressiva. Which syndrome leads to developmental delays and growth issues? A. Cystic fibrosis, or B. Asperger syndrome, or C. Down syndrome, or D. Prader-Willi syndrome. The correct answer is D. Prader-Willi syndrome. What syndrome is linked with short stature and dysmorphic features? A. Crouzon syndrome, or B. Klinefelter syndrome, or C. Turner syndrome, or D. Down syndrome. The correct answer is C. Turner syndrome. Thanks for watching. Comment with how many questions you got correct. Should we make the next video have easier or harder problems? Was the difficulty just right? Do you have suggestions for future trivia topics? Don't forget to drop a like and sub if you enjoyed the video.